Ubluchanu mute, man mutikidlugu dan nuban na yuar 19 nunavut iluani ngito dan kawenak tu yuar te ukarangama ukaktu luarangama man mutikidlugu 485 kawiyak tau himayut inuit 235 utak kaya huli takwa kawihang ni uting ito huli 250 kawi naktu nubar yuar 19 kangitun kawehu tu nga man unika tu lo minda unika on ukak tu lo mata ko government could nang ming yakota Nunavut Development Corporation akwa kina parnik o baluwa taluang ni tay kwa tamona ato hokta wota hananya mata 5,000 mi hananya mata tak takwa 500 man namut tuniyaw ni ating mihok tu ikinatunut government to kakut pakoya malik dugut atokaya kalakapta kinap pamikin ting mihok mikinarangapta takwa kinap pait hanahimayut nuvakami ermik tu luit atuk kanyak tu luit matakwa hanayaw ningit pakoyang nut malit charsutit atogang ni atoa charsutit hanahimayut kihani takwa atokalo su takwa ungahik te raunak ublaluk tanginak agabut ermik tarluik ermiumut takwa huli atokaya khaktabutan Iqaluit hinauto takwa atolugit amakina pang atoluta tingmihumo ikigata upaluba atoramertu Amataw kanu takwa hana yoru la mangata inunut hana ingmini hana waktunut tunihiyu laktugut takwa inuit ingmini hana lutit atolut bigwang na pata maubla tu halaw na la bitakwa Canada Prime Minister nga ukalaw matakwa ilin na tuti bugo kina taktu lang na matatan na nuban na 19 pidjitotugo kina takwa gayak tangi May April, May, June mutakwa takin pingahunut tana nui hama hakke hamat mana huli kawimang itu kanutana kina ya kaitaw niya mga ubaluba kanu ilin niya tutit tuniyaw niya mga tana kihena kuwew pugutakwa ilin niya tutibu kina ya tao malamata amma takwa ilin niya tutibu tao fans government kuna ilin niya kunai kwa fans ni kina ta hoktut takwa ihulin nela mata April 30 kina ta hokting ihulin nela kihani may milin na kanang na pata takwa kayulu ya mera yaktut kawiga tu lit titi amma titi kakta lok tu takwa ilin na tu tibu takwa kina ta hokting fans ni ta na takinu pat ihulin nela mata amatan ta ublumiu yok nunak ya ublorik magu kablunatu Earth Day tana katil luta kowe huk luta tana pihokalwa aptigo mana tena ingitu tana nuvan na yo 19 pijuto luni ila ko meluta kowe huk luta tana nuna yo akot ubdori mago kowe huk ta tana amma kwa adjung itu kuman na outla kalwak tugut ayong na kutuku outla mahluta kihani uwap tini menere chaluta ihumabut amma timi buyu ihumay chalugo tana inutu ila inutu nginapta atau he katigiluta tana anigong na miyabun tana nunak yo ubdore mago kuwehu luta kuwehu chaluta pinaput mat napahi the English version. There are still no confirmed or probable cases of COVID-19 in Nunavut. To date, total number of 485 have been investigated, 235 are still under investigation, and 250 have been cleared and do not have COVID-19. I am happy to announce that through the Nunavut Development Corporation, the government of Nunavut is funding seamstress to make 5,000 face masks for elders. Nunavut with underlying health conditions and non-medical first responders like firefighters. At least 500 have been set aside immediately for our air travelers to comply with Transport Canada new requirements for travelers. These masks will be made of cotton. They are washable, reusable, and are made according to national standards and guidelines. They are not meant to replace other measures such as social distancing and washing hands, but give us an additional layer of protection. Simple how-to instructions are being developed so people can sew their own at home. And as you may have heard this morning, the Prime Minister announced that funding and opportunities for students in response to COVID-19. We look forward to receiving more information on these programs and how they will help Nunavut students as the summer approaches. From our end, FAN students, payment for this school year ends on April 30, unless their program continues into May. We are committed to our students and to help them succeed in their post-secondary opportunities. Students are encouraged to book travel back home to their home communities before May 1 and should check their email for more information. Today is Earth Day, and that looks different this year than most. We can't enjoy our parks or come together in groups outside to celebrate. What we can do is hold on to the importance of keeping ourselves and our environment healthy. Healthy Nunavut Mute, healthy communities, and a healthy territory than ever. This year, let's celebrate Earth Day apart to ensure we're all healthy. Thank you.
Kent Driscoll, APTN National News. Dr. Patterson, I want to go back a little to the public health order that your office put out. The emergency powers in that health emergency that you declared, they include warrantless entry by police. Now, other public health orders in Canada haven't included that particular clause. What I'm wondering, what's the public health need for warrantless entry?
Kent Driscoll, APTN, Dr. Patterson, Takwa Kikulimano, Anna Hamang Tulerin and Motilis Jutigissimayate, Ibella Binganing Arsuni, Dover Naktukusangin, Hauta Matsolo, Palisiku, Pipa, Hangilutisirun Naktugu, Lugaya unit, asking in Nilikana Tamite, made it in Matahano, Letamana, they made Takatamani, Nunavut.
Thanks, Kent. To be perfectly honest, I don't think that there's I can't think of a reason that we'll be using that power. The only time, like when we, on those rare occasions where people have had to be apprehended for isolation due to a communicable disease, it's a very specific order written for that one person. And so, yeah, that is an option that was written into the Act a long time ago, or a while ago. This one was passed a few years ago and came into force on January 1st. But is it one that I'm going to be exercising in this circumstance? I don't think so.
Kisah ni sama nagayak tu, tigo yo hara hakka solo ani tele khuya usima yumi siam magunak tu mi anna hak tu mi solo tau semino mutuka ngagunak tu. Dan nalira ko titsa yo pe khuya muili ya ulau usima yo kagu galaina usima laktu amalu January 1 mi atula usima yo kisah ni tan atula usima jabal lain itaka.
Point to make for the interpretation. So just so I'm clear about it, it was written into the legislation, but then enacted by your office, and that warrantless entry was a part of the part of when you flip the switch, that's something that comes on. Am I correct in that, or was it something that was added by your office?
No, that's my understanding. Sorry.
Pihuya te tau si maluni tāna solo palisik ko piyo na te hangilu te paipaharea tungilu te esiru nakningi tāna e biala bingago ili yau tu nakniko.
Mamianuk.
It's okay.
Yes, that's exactly it, that it's written into the act, and when the emergency is declared, then that becomes an option, but we can choose not to exercise it.
I suli yuti tāna pihuya mo ili yau si mayok to aver naktukut atok tau gun naktu naluna yak tau si mayok haktilugo kisani tāna le kaya ko titsatu na kisani atok tau jako ito.
Beth Brown, CBC. My questions follow along with Kent's. We've heard that parties are being broken up by peace officers, specifically in the community of Iqaluit. I want to know, is it legal, is it lawful for those bylaw officers to be entering someone's home without a warrant? And can you lay out the requirements from the Public Health Act that would allow someone to enter a residence without a warrant?
Beth Brown, CBC, people yulari kuni. To sakatas mamatau tāna solo hovia so hatigi to ni pardik to ni pilok to me holok to me. Taina maligakti go piyo na te hat selo ka tako paipa hakati isirun na to me isirun nakningi kikutu na nane hanang ituliri ng mo peko yakti go tayo mailo no isitu na unakan.
Thanks. I'm not aware of the circumstances of when the officers went into houses or how that's being done. The circumstances where a public health emergency would make it useful or that we'd take advantage of that power as I don't foresee that happening with the current circumstances. And these bylaw officers are have not been engaging with my office in doing this, and I believe they've also been using the bylaws that the Hamlet has passed, their curfew and those things, and they're enforcing those acts that are separate from the authority of the public health emergency.
Kau yung mga ito nga tako ato sa lagung itaka kanu ilok to ng mga kanuklo isik ng mga ta kisinipid juta kaksutik tana to awang naktulorin ng mo anya kang mga itulorin ng mo ato te kakam naktugalo tana sangini gunang ninga kisani manaw yu atok tawag ato suking itaka tako alo palisingwan baila uvan nga alabing ano kau yigalo sa mga itut tako atu pichuta katuin na kaya hamlak kuno malika kalakop titaw ni minakni.
And if I may just supplement Dr. Patterson's response with direct wording from the legislation. It states in Section 49 that where an individual's rights or freedoms are restricted as a result of the exercise of a power or the performance of a duty under this Act, the regulations or an order made under this Act, the restriction must be no greater than is reasonably required in the circumstances to respond to a disease, health hazard, public health emergency, or contravention of this Act, the regulations or an order made under this Act. The reasoning behind that is that public health officials and law enforcement agencies cannot enter private homes without a warrant unless there is consent or in extenuating circumstances, the legal description.
Okay. I'll just do this. Ta nailagay ang luguluta Patterson no kausa katakta nga takwa ilangan ito maligaw iluan ni 49 mi piyon na ito ng boy sa may nakita karon na ng muna luna si mama pihuyak ni awla si duty tigo takwa gusang ginaksaw gaya kang ito kasi ani pidyo to hat siya lutik sulo anya nakto hatilugus sa maktaw gun naktunik kanuin nakmulolo kaya naktumigo tao tilugi tamakwa ane kang nangitulirin ng muka mayo yun o balo palisyo yun isira kang ito kasi nangyak tao si makalong lutisiwong ngago.
With regards to the specific circumstance in Iqaluit that was reported, again, I don't know any more details other than what was printed in the media. So that question would probably be best directed to the Hamlet Council on what direction they've given their bylaw officers.
Tana pidyo tigilugo to sa tao si mayo tako si mamago kasi ane pivalya yu tigo kalimaksiniyo dahil ko kay cute siya kung nanakpahamlak ko kanok tilisi sa malaw mga ta palising wangin ni.
description that you referenced just now answers some of my question here, but because the Charter of Rights doesn't allow police officers to enter someone's home without a warrant, we're looking for a bit of an explanation on how someone's rights are impacted or changed based on the public health emergency and the acts that are, or the orders that are coming along with it. And perhaps, this is again a second part of the question, where we're hearing that people who are under investigation are subject to perhaps a fine if they're not following the rules. But for the rest of the general public, can you explain what could happen if they throw a party or aren't doing social distancing? Can someone be fined? Can they go to jail? Or are they just going to be reprimanded or asked to behave otherwise?
Okay. Takwa pijutigil lugi isirun nangin matago kanata pihoyak joang itigo pijun nauti pijutigil lugit uhausirigun nakigi takwa kano pijun nauti yu atuk taus mamanga tamakununga tilisidjuti usmayunu malik tau gialinnut tamakwa lupilo aktumi hanimahangin kalwa mga takawyasak tau valleatil lugit akiliti taugun nakayakha tubbalo kikkutuin na yahanorli takwa sulu party kumalir nakata malit siyang illutino katigi katitiliga harningin ni kanui taugun nakha.
Thanks for the question, Beth. The intent when we put the original, the Public Health Act into play and that just came into force January 1st was if somebody were non-compliant, for an example, if somebody did have a communicable disease such as COVID-19 or tuberculosis and were refusing to follow the guidelines that were put to them by physicians or by the medical staff, that gives an opportunity to be able to make sure that communicable disease is not spread or contagion around the community.
Kuyan nami tana pidjutinga kikkutuin na nahanang itulirin mo pihuyak tana tulila to January 1 ngunnekat tuwa nga tuin naktutay kuno nga malingit tunut solo siyak magun naktunaan na hang narutin wat juar na 19 mig ubalo po valo naktuhang narutik kipilo pata malitaw gaya hakutaw gutiyo yuni lutano tana pivika gutiyo yok tako siyak maktaw valle ako nagi.
With regards to the rest of your question, Beth, it would be so case specific on when any fines or any other punishments would be levied against an individual for breaking the rules. There could be any number of scenarios. An example would be maybe to use a house party as an example. If a law enforcement officer were to knock on the door and it was answered and you see 40 people in the household, then that would potentially lead to a further investigation.
Tanapik ko TV lang ano imikko ta ruta video ayakto atuni tawlo ni surlo akiliti taw yo kakayakto inakto taw yo halurin do ni kisian ni sihumitsi yo hamnakat adjiging ito ni lupit juta haron narlutik surlo ang ikarayaw yo may amisulu ti parter nakatapali si kailo ni ino kakalo ni 40 ni surlo how you saktaw gakan na kung nakayakto tako kano sihumitsi man ng mga ta.
I guess I'll try to be a bit more clear. So in this particular case, bylaw officers came or peace officers came to someone's home. We have the Charter of Rights and we have this new public health emergency. How are someone's individual rights changed? So for residents, how do they know how to respond or what is available to them in that situation that's different now than before the public health emergency?
Tukisiga kan na kumagako tana pidyo tigilugo pidyo tawlaok to tana palisingo isung nangan tay ang ikarayaw yamon takolo kana talimami pidyo na to hasuta pero yarjo atigo tana lumana ana hamnang itulana mo tilisidyo taw sa maluni kano kiyo kataron na kaya karubalo kano tay kwa tay may gutaw yo kano ilaw ka kakayakan.
Thanks again for the follow-up, Beth. With regards to the act itself, it's very specific under what circumstances a law enforcement agent could enter the premises. I can't speak to the circumstances what that was reported. I'm not aware of the details, but I can give maybe an example. I visit a lot of homes throughout my career, and sometimes you have to go through the porch to actually get to the door to knock on the door, and if you see 50 pairs of shoes in the porch, it might lead to suspicion. I'll leave it at that.
Hoyanna mi aperikanera vitana pihoyartigunalo na ersimatsiallarittu hannoqtaana malittaukartaulerayarmanga isirunnanermun taanale apeqqutigiai kiullattaarunnangi taqaluara ilulingi hauyimanginakit pilareaqattarsimagamiligu iserlunni illunut suurlu isigaujarasaalunni takuguvi isumanalerajarnga susuqarmanga amma summakatimattarmangata.
Rajni Sharma, Nunavut News. Dr. Patterson, I'm just looking for some updates today. I was wondering, are there any updates about obtaining testing devices for the territory that you could share with us today? Like, has anything changed?
Sharma Nunavut pivallaayulerikkunnik ullumimu tusaraakkannerumayo taakku qauyisaruti pijjutigillugi qanuilingaleqqat pigassuartasi.
There's a small number of cartridges available for the Gene Expert testing. We are using those to validate our machine before we can provide any testing in territory, and until there's a sustainable supply, we will be reserving those for absolute emergencies.
Khatsinei taakku qauyisarutit tikisimalertut uutturautionaarlutik aungitigut suurlu taana qauyisarutiu qanuingikkaluarmanga tammaqattarayanngikkaluarmanga qauyisarunnarsilaunginittinni kisaani maannaujuamiakkugijavut atoqtaukkatteilkeinnarniartavu kisaani tuavernartumiillarilerutta taakku pisimakainnaniartavu.
Also, at this point, do you feel that there are enough PPEs for health staff, ventilators, and swabs for testing within the territory? Are we like good on those fronts?
Taakku ali pijjutigillugi maannaujo sapummigutiujuttimimut qanimmatteiligu seammarteiligutit ammalu anersaartuutiit qauyisarutit taakku ali maanna naammatserivigin.
I'll sort of deal with it in three parts. We're quite good with ventilators. We have 5 more that have arrived either yesterday or the day before. So within the Department of Health, we have 12, which for a population of 38,000 is very good. Swabs are getting better. We have a large shipment en route from federal government of Canada, and a larger shipment coming from a private company. PPE is still a bit of a concern, but less than it was a few weeks ago, and there's more coming in on a fairly regular basis. We have enough. Sorry.
Taana pingasuulingalugu apersum ila kiuneartara tamakkuali anersaartuuti pijjutigillugit tallimakkanerni tikittoqaloortuqippatsaaqubbalippatsaani 12 ngulertuitaakku aanneaharnangittuleriyikku anersaartuutit saugajartu 38,000 utillugi inerrutiivu tamanna piuyummariussurijarali qauyissartaugutissaillu piunersaulertut amisualunni tikitaunearmiyugu kanatau gavamakkuginnik ammalu nammineqartiujuni tikisaissimalluta taakkualittau sapummiyaugutit suurlu matuarujuit isumaaluutiuluanginersaulertu taimanganiulaungani.
The PPE is certainly enough to keep us going for a few weeks if we had significant emergencies in a number of areas across the territory, but we're still hoping to expand our supply. And with things improving with our partners in the south, they have more capacity than for intensive care units than we might have expected. So the need for ventilators is less pressing than it was a few weeks ago.
Takwa pijutigillugi sapummigu ju siamartailigu ju atortauqattariali naammanakainnarniarnila naamakainnarniartu pinassuarusigalauniartuni kisaani tuavirnartu larikkuulerneruttaa suli pikkanneriaqarayartugut taakkualu pileriqatigitsiarnersarileriqattigu qallunaani katutiseqatigiqattartavut ammalu qallunaani aanniarbialunni tamakkualu inuugunniarniusajunut aanniarbimmi unitsimaviit at iniqarnersaulersutik ammalu anersaartuutiqarnersaulersutik maannauju taakku isumaalunnerunniinnersaussimajullumima.
Thank you.
Nunavut News. Just looking for an update on how many teachers who were down south have been able to return. And then if I could add to that as well, wondering how many are currently working from home. I know they were mandated to go to the schools yesterday, but some of them are working from home.
Emma Trantununa Chapi Vallejo Yikuni, to Sayaroma, Hatsu Mangata, Ilinati, Halunani, Tikisimaletut, Hatsu Mangata, Kanaya Letut, Amalo, Hatsu Mangata, Kangin, Kanaya, would not tell you.
Thank you for the question. We don't know how many teachers currently are at the isolation centers, but a week ago there was 24 teachers in the isolation centers in the south. And I don't know how many teachers are working from home or in the schools. The Department of Education is working on that, and it's varied, I'm sure, depending on community and availability of staff. Maanata ko ilinnertitsi qabunanunani tuqap qappiu mangata utaqqiyu nunumuitawaarlutit amma qappin tamongu nunumuutaqi malamangata qawimangitua kihan ikpakhaniulartu 24 qabunanunani inutu vingmilartu amma oqarnaariortunga qappilinnniartitsi pilerimangata uvaguani qappilinnnaarving pilerimangata taakwa inlinnaartulerikut kamangimmagut qawimanaqautiariartu.
And just following up on Beth and Kent's questions, I'm wondering if anyone has been charged under the quarantine order signed by Dr. Patterson.
Beth, I'm looking at the Kutiaka, I like a passage to help to Halau Kata, or did you Jitigisimayati Sekimikasimanin?
No, we haven't had to. Where COVID-19 is still not in territory, we're focusing on education and getting people to understand the seriousness of it that way. And although there are a number of people who are ignoring those restrictions, we know that it's working. The majority of people are following the advice and the orders that we've given out because it's had a significant dent on all other viral infections.
Aga. Nuvadjoam nak 19 tahartin dagotamani suli Nunavummi. Toraga haloaron narsimagata ilinnertit sinermi kammalu pimmariuningani tukestitsit saarasuaqattarsuta ilangi naalatsiaqattangittuugalua kisianaamisuunersai naalatsiaqattangata tilijaujutiussimayunik tamannalu qaujinarsimalluni asinginni qanimannatuinnarnik siarmanginnersauqattalerninginni qaujinartummarialuusimamma tamanna.
This is probably a question for the Transportation Minister. I'm wondering, ITK President Natan Obed spoke at a National Health Committee yesterday and reiterated the fact that he would like the federal government to designate airlines in the north as an essential service. Do you have any update on whether the federal government is considering that at this point? And do you have any update on whether more funding or additional funding will come for the airlines at this point?
Iqaluit Minister Muatan Napiqutiu Valayakana Inuitabrika Nataminaten Obed Kanatamiana Hamnangitulerina Mukatimayagalangin Nisangan Nilaungat Laluneto Hujiluni Government Hakunutako Hangatayuliku Pitaharakan Larininganik to Saxmavi Isamasaxio Simamanga Tagavamakuta Government Hakutama Tuminga Malo Kina Yaktakan ng New Savisi Ilatan Hangatayuli Junutuakinitako Pijutigilum.
Kaya na may tas mga aperigawin. Udlumi mo tayo na Prime Minister o kausagalaw tanga tayo na mana mo takin pinga sunod akisimaman te na kina nireugiavo te ko na pinasuni taki kanyu na mi patat I nireutiartugun su pidjutegitlugu taakkuat mi kangata su akkotituarigattigun namungaras nittinit taakkua pimmariuningano taana aksorotiginnarniartagun. Thank you for the question. As the Prime Minister announced a week ago about the $5 million towards the airlines, that was for 3 months, and that's the money that we'll be receiving. So that's if it's going to extend more than 3 months, then we definitely will be seeking for more. There's, as we've been stating, that the airline is our road system, and it's our only way in and out of this territory, and something that it is quite critical to have a functioning airline in our territory. So one way or another, we will continue to look for support. But at this time, the Prime Minister made that commitment for the territory. Thank you.
Kent Driscoll, APTN National News. Dr. Patterson. First, a science question. The steps that are being taken to fight COVID-19 would also seem to be applicable to many of the other infectious diseases that plague the territory, RSV, tuberculosis. I'm wondering if your office has any preliminary data on whether the steps you're taking for COVID-19 are having an effect on other viral infections.
Kent Driscoll, APTN Connect, Luta Patterson, Tana Civil Lakbaka, Saktulerina Motorangayo, Takwa Hanuli Rotayo. Tiki kunago Nunavut 19 Nunavut asingin nato te hariva so lutako RSV ipinele rutao so kamalo puvalu naktemut si amangin naksauguti simavata ko Nunavut 19 mo malitao karutayo.
Thanks. Not for TB. It takes months or years to notice that kind of a difference with tuberculosis, so it's far too soon to tell with that. There's definitely been a significant drop in influenza and RSV infections when we look at this month over the couple of months before we brought the restrictions and orders in place, and when we look at last year at the same time. And there's also been a significant drop in medevacs.
Hoyan nami tako ali puvalu naktumo atu ti khaluangito khawyin asagayanga kasi ani takirasayok pala kago kasay atu ti khasmamangata maluman na khilami ulwakto khawyi jagun nakninga kasi ani katat simalakito itako ipinanak tukta hatakto RSV mig amalo kasi ani tako nalunang ito asing khanim magayun nakto surlo upeng ako khanim manaw gayo tu katat palir simalakito ambalo hanga tayo ko lakti tayo gali katapalik sa mayong makaloy.
And I'm also wondering, you've had around 50 tests come in since Monday, but there's still 235 waiting to be completed, investigations waiting to be completed. Now, the best comparison to Nunavut, it's not always a one-to-one comparison, but the NWT is the area of the country that has the most in common with us. They've received back 1,600 tests, and their average wait time is 4 days. And they plan to have 1 hour testing in about a week. Why are Nunavut's tests taking so long to complete compared to other northern jurisdictions?
How you go mamiyo ta ko ila Nunavut asingin no khano itu ninga isumagina lawangi makisani tay na hanigi yo yar nak pavenu na tsermi kanata mi utawluta ta ko alugo how you sarum nak sila ngata 1,600 ni amalu how you sakta go to cheu to hat tak suti luisita matu na inagay mata amalo 1 hour mi how you sakuti go nak to mi pinasa ko seula to mi pigala suti sumalita man na Nunavut mi kingo vaksima yung makayalo ba ato inawningin.
It's largely dependent upon flight time to get the tests. The average turnaround time for the tests for the territory as a whole is somewhere around 6.5 to 7 days. The difficulty for us is that we're trying to report tests from up to 5 different jurisdictions, and so We're sticking with reporting the people under investigation. For some people, that means they might get 1 or 2 tests done, but still stay as a person under investigation for a full 14 days to ensure that they're safe to come out of isolation.
Pidjutigi jaulo arna pango yo hangatayo hakuna hangatayo hatsia la hangatayo lerinamon takwale ulluni 6.5 mi 7 ulluni utakiga yo patugo utakitauga soartillugit ammalo ayong nakatanga nalo na iraswarlugit allimani avittorsema viuni ngaartuni khawiyisartauyuni tukisigia qasoaqattaria haqatta atausia maqqutilluni khawiyisartauqattaria harsuti sulilo maligia harsuti khawiyisartau gutingi utilaunginninginni ulluni 14 ni anigunnarsilaunginninginni.
Beth Brown, CBC. I want to ask about testing as well. The requirements for testing have been lowered, but the rates of Nunavut's testing are much lower compared to the other territories. We have seen some more tests be done in the last week or so. Why have these numbers not increased?
Beth Brown, CBC kunnik khawiyisartnermuttau khawsaqarumayortaakkualu amisuuneqsee khawiyisartaugunnartaulera yummata taakkualu khatsiuningit khatsinaunerpaangullutik pinasuaqussiulaortumilu tamanna tusalaortavu pillugu qanuilingaлекqa.
Thanks. Our understanding is that there's been less people presenting with symptoms of any kind of viral respiratory tract infection, and we're continuing to look at communities that are having very low rates of testing and asking the nurses to be a little more liberal, or nurses or physicians to be a little more liberal in swabbing in those communities to make sure that we're not missing hidden transmission of COVID-19.
Oh, hold on. Takko khatsinaunersei tamakkuninga khanimannaarsuhartuinnareaharsoriyauyu khatsinauqattalengata upagutiyu balunalunairutiu taimaan nuvajuanartoqangikkaluarmangaamik khatsinaunersauqattartu naanniasiortiilu taalu haussi ila tilisimajavu nunalinni amisuunersanik qawiyisaqattaqullugit aimaa qawiyausmangittuni nuvajuarnartu 19 qatuinnarealinni puigortausila qawiyau ngittoqarsimaqunagu.
I want to ask a much simpler question. We have no cases that are confirmed so far. We haven't had people traveling into the territory for quite some time. Around the time cases started being much higher in southern Canada, that's when our travel restrictions were put in place. Do you think that COVID has already come to Nunavut and maybe people just got better? Do you think that it was here or is here and we just haven't found it yet?
Apekkuti taakkuangila nuvajuarnartoqa ngigianga sulinalunartausimamma tammalu tikigunnartitsigunni yutsusi hallunaani amisunngupallialertillugi tikittailititsiliyugatsi tamaani nuvajuarnaq 19 taharsuriview pitaqalaorsimassuriview balu pitaqatuinnareaqarsuriview.
I think it's possible that 1 or 2 people picked up COVID in the south or somewhere on their travels, returned to Nunavut and self-isolated and got better on their own. I've talked to a few people who I would have said I was very suspicious. The only way to really answer that question is to do blood work on antibodies, and there is yet to be a nationally recognized Health Canada approved blood test for antibodies. So we can't answer that question for sure right now. I think, sorry, I'll let that get translated and then I'll finish.
Ja tausummi makkuunillunni hallunaani ngaartuminirni tamaanga tikisimayuni natsartoqatuinnareaqarsimayu taakkuutersimayuni tammini anittailitigiaqaqattarsimayuni qanuigunni simassuriyaangi taakku taimaittoqartumini ugaluarlutik kisaani qawjivitsaugayaanga aungitigu qawjisartauluni tamakkuninga timingata annaumajjutingi qawjisartaulutik suli qawjisarutini lukanatami taimaittuni nalunaertaussimayu qalauqani.
The week where we closed the schools and then brought in the greater restrictions, there was a legitimate concern that there could be COVID-19 in territory, and we just didn't know about it because it takes a week to get results, which again is not acceptable. Right now, if there had been COVID-19 introduced before we closed the border, we would have seen evidence of it by now. Even if without tests, we would have seen increased presentations to the hospitals and to the health centers with cough, fever, and other respiratory tract infections. We would have seen increased medevacs and admissions. And we have seen all of those drop over the last 3 to 4 weeks. So I'm pretty certain as anybody can be, that there's no hidden transmission of COVID-19 happening in Nunavut at this time.
Taigani pinasarusingani matuyautillugi ilinniarbiit isumana jojo inuvatjoarnartoqarne qatamaani Nunavummi pinasarusilimaami qauyinaqajangakisiani tamannalunaamagani qauyisaruti natuinnahaluanginittinnut maannauju nuvatjoarnar 19 nartoqarianga qauyinanngittoq pasagussanunngittoq amisuunersaugajangataaanniarbialuleaqattariartu nunalinnilu aanniarbimmut suurlu uuternartoqarluti ipinearlutilluunni quirsuqattartunilluunni qauyinaluarsimangittoq tamakkua katallaritsimammata asinginni qanimassitnartaahattartu taimaimma qauyimagatta taakkua malittauqartavu atuutiqatsiarninginni.
I'd just like to follow up with the question regarding the number of tests. I know Dr. Patterson has raised a number of times now that when we look at easing some of the restrictions, one of the conditions of that will be to have testing available in the territory.
Takua kiugumammi jaqatsiuqattarninginnu qauyissartauqattartu luutaa Patterson uqarataangat isamassarsiurutti qalirutta tamakkua qasuliauvallianiarmangaata maliktaugiaqartu amisuunersani qauyissaqattariaqarajangata.
It has been a concern that's brought to my attention a number of times, with concern on the apparent low amount of tests that are being done in Nunavut. I do want to ask people to take into consideration, although Northwest Territories and Yukon are similar to Nunavut, they're still very different, where there's a higher concentration of populations in their capital city, which leads to more contact tracing, which leads to more potential to exposure.
Tanna isamaaluutiu neraqtaugianga uvannu qauyikkautauqattarsimamma qatsiinnauluaqsoriaulluti qauyissartauqattartut nunatsiaami Yukon milu taima nalimuguutitauqattartuugalua kisiana adjigiingillari kattigu amisuunersaullutik taakkua tuttarpinginni nunalirjuanginniittu tammalu amisuunersanik kikkunnik takunnarmangaata qauyissaqattariaqaqqajartuti.
So I think if you would look at the other two territories, if you looked at the testing done in their smaller communities, I would be quite confident that we would be similar, if not even higher. If you look at the amount of testing that is done territory-wide and how liberal our parameters are for testing, we're very confident that we are getting access to people that are presenting any suspicion.
Takulugi makku ukiortartumiutauqativua vittorsimamniuju nunatsaami Yukon milu nalunangittu qauyissaqattartu taimaa mikinersoyuni nunaligni taimaa tsainnauvagutitut ubbalunni amisuunersani qauyissaqattatutsavugu taakkua qauyissartauqattaqujavu amisongoriartauqujugatigu.
Thank you.